This is a presentation on chronic back pain among veterans. iReach program is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by HRSA, HHS, or the U.S. government. Learning objectives for this presentation is to understand prevalence of chronic low back pain, chronic low back pain among veterans, and how to work with veterans who have chronic low back pain. Let's get started. Chronic low back pain is usually defined as back pain lasting more than 3 to 6 months. Chronic low back pain occurs with or without radiating pain to the legs. Cause of chronic low back pain can vary. It could be caused by not only issues at the back, but also other issues, such as changes in neurons in the central nervous system, which I will talk about in the Module 2 presentation about back pain health. Chronic low back pain is generally difficult to treat than acute low back pain. And then chronic low back pain is major contributors to disability, reduced quality of life, and healthcare burden. Moving on, the prevalence of chronic low back pain. As you know, the prevalence of chronic low back pain is huge. There are so many people who experience chronic low back pain. Actually, more than 500,000,000 people worldwide experience with chronic low back pain. When we look at the United States only, 30 to 40% of the people, meaning more than 100 million people, experience chronic low back pain. Chronic low back pain is the most common chronic pain condition among any chronic pain conditions you can imagine. Surprisingly, number of people who are suffering from chronic low back pain is still increasing. When we take a look at the prevalence of chronic low back pain among veterans, it is even larger than the prevalence of chronic low back pain in the US general population. More than half of the veterans seeking health care in the VA clinics are veterans with chronic pain. And then among those, about half of them actually seeking health care because of the chronic low back pain. Therefore, the same as the US general population, chronic low back pain is a major leading cause of disability and reduced quality of life among veterans. Alright, so in terms of symptoms and comorbidities of chronic low back pain, the most important and then the most obvious symptom of chronic low back pain is back pain. And then when you also have any lesion or compression to the spinal cord or peripheral nerves, you may also have radiating pain to the buttocks and legs, as well as numbness or tinglings of the buttocks and legs. Furthermore, there are some risk factors or associated factors for chronic low back pain among veterans. For example, those with traumatic life events or PTSD, post-traumatic stress disorder, are more susceptible to having chronic low back pain. There are also associated symptoms known as comorbidities, meaning that people with chronic low back pain often also present with the symptoms including depression, anxiety, poor sleep, emotional distress, fear avoidance, and fatigue. So how should healthcare providers or caregivers work with the veterans with chronic low back pain. Of course, their main complaint likely is back pain. However, we also want to pay attention to the risk factors and associated symptoms for the better treatment outcomes. For example, depression, PTSD, and poor sleep are very common among veterans, and also those symptoms are closely associated with chronic pain. Therefore, we need to address not only for back pain itself, but also these symptoms or factors for better management of chronic low back pain. Let's say your patients, veterans, uh, experience not only with the chronic low back pain, but also with the severe depressive symptoms. And then you may want to consider refer that patient to the psychiatrist or clinical psychologist to treat depressive symptoms as well to obtain the better treatment outcomes as a whole to improve his or her back pain after the treatment. With that, I'd like to conclude my presentation. Thank you for listening, and please also check other educational resources at iReach program, covering various topics related to veterans health. Thank you.